Hello, I'm Dr. Kevin Croston. I'm the Chief Executive Officer of North Memorial Health. Today we're in the emergency department, and I thought you'd appreciate a chance to talk to a couple of people that are working in an emergency department during a COVID-19 pandemic. We have Mario here, who's been here all of 12 days, and we've got Bonnie, who's been here now I think a while, 12 years maybe. So you'll get a different perspective from both of them. Mario, you used to be an engineer, now you're here in the emergency department. What possessed that?
I had a great time in engineering. It was wonderful. I manufactured stents. It was a great way to help people every day. But I wasn't too close to the patient in the engineering role that I had, so I wanted to get into the room with the patient. It seemed like a great place to do it. Great change in pace and a good way to help out the community.
Oh, that's great. What have you noticed since you've been here yet? What do you think of the staff and how they're doing? I know you're 12 days old and like to keep your job, but
Yeah.
what do you think of them?
Exactly. Brand new, but there's a huge sense of service here where things that, from a newbie's perspective, it would be a big deal to come in as a patient and experience this thing, but for the healthcare team here, they're providing care in a way that's totally service oriented.
Well said. Thank you, Mario. So Bonnie, you and I are old pals. We've been around for about 12 years here
Yep.
together. You've been in different roles in the hospital, but now you're here in the emergency department. Tell me how it's going.
It's going great. I really enjoyed the transition between going from the street into the emergency department. Getting to work with respiratory therapists, physicians again has been a really...
And that's the best part, right?
Yes.
Yeah.
It's been an eye-opening experience, and it's been really nice to be able to learn, alongside physicians, and when you see conditions coming across, and just learning how to deal with things differently than when I did when I was on the street in America.
How's your perspective in a pandemic? I mean, what do you see going on here? I imagine you've seen your team members come in here sick. What's that kind of a toll does that take on you? How is everybody responding to that?
I think one of the hardest things emotionally that we deal with is when one of our coworkers comes in. Obviously, we're seeing some of the worst cases, so our mind can automatically go to, someone that we've been working alongside with, going to meet the worst case scenario in this COVID situation. So that's been very difficult to deal with. But so far, everyone's been making some pretty good recoveries. A lot of them have come back to work already. They're able to tell us their experience, and we realize that we can keep pushing forward on this thing. Where the more time that goes by, the more we know how to deal with it, the more we're able to quickly treat and recognize what's going on.
Yeah, well said. Thank you, Bonnie. So Mario, 12 days into your new career here, do you have any comments for the community on what you'd like them to do to help all these people here that are working in our emergency department?
I'd say stay masked up, stay socially distant, and come in and get tested if you're not feeling well.
3 rules to live by from Mario and from Bonnie. Thanks, everybody.